Hi, I'm Huda.
And I'm Gabriella, and we're going to talk about olivopontocerebellar atrophy, also known as OPCA.
Natural course of OPCA. OPCA is a neurodegenerative disease. This means that it's a progressive deterioration of nerve cells in certain parts of the brain. OPCA is characterized by slow progressive deterioration in balance, also known as disequilibrium, coordination of voluntary movements, cerebellar ataxia. This typically begins in lower extremities and progresses to upper extremities and musculatures. Speaking, muscles involved in speech weaken. Age of onset is typically mid-50s, and men and women are equally affected. An estimated 3 to 5 out of 100,000 are affected in the U.S. Approximately 50% of individuals are wheelchair-bound within 5 to 6 years of symptom onset.
Presenting characteristics of OPCA include increased clumsiness, balance challenges, speech and swallowing challenges, increased difficulty in walking, abnormal eye movement, muscle spasms, numbness or tingling in hands or feet, cognitive and memory difficulty, bladder and bowel control challenges, and sleeping challenges.
Locations in nervous system that are affected. Inferior olivary nucleus is within the medulla, involved with balance, which is involved with balance, coordination, and motor movement. Second, cerebellum, which is responsible for balance, posture, coordinating, voluntary movement. And third, the pons contains important neural pathways between the cerebellum, cerebrum, and the spinal cord.
Characteristics specific to speech, language, and swallowing. OPCA is associated with dysarthria. Dysarthria is a neurological motor speech disorder that results from challenges in strength, speed, range, steadiness, tone, or overall accuracy of movements, which are all necessary to control speech production. There are many different types of dysarthria, but OPCA is most commonly associated with mixed spastic ataxic. However, flaccid and hypokinetic dysarthria can also be present. Going into a little bit more detail, spastic dysarthria involves upper motor neuron damage, that's usually bilateral, and speech sounds weaker. The speed changes, precision changes, range of motion is limited, and coordination of speech musculature movements diminish. Ataxic dysarthria involves damage in the cerebellum circuit. Speech sounds slurred, almost inebriated sounding, and the gait is affected similarly to the speech. Flaccid dysarthria involves lower motor neuron damage, as well as one or more cranial nerves. And the speech sounds hypernasal, imprecise constant productions. Speech sounds breathy, and nasal emission can be affected. And lastly, hypokinetic dysarthria involves damage in the basal ganglia circuit. Again, speech sounds hoarse, harsh, breathy. There's reduced pitch. Loudness is affected. There's imprecise consonant and distorted vowels lead to speech sounding mumbled and slurred.
The etiology of OPCA. OPCA can be classified based on 3 findings: clinical, genetic, and neuropathological. OPCA is currently used as a preliminary diagnosis. This means that typically when an individual first gets diagnosed with OPCA, later on when the diagnosis is further concrete, they will be diagnosed with something more specific. OPCA is associated with 2 distinct groups: multiple system atrophy, associated with sporadic OPCA, meaning there is no current evidence of a hereditary component, and spinocerebellar ataxia, which has a hereditary component.
Going into more detail about MSA, MSA, like OPCA, is a progressive neurodegenerative disorder that's associated with autonomic failure, Parkinson's, cerebral ataxia, and pyramidal symptoms. Most common features include decreased ability to regulate blood, difficulty coordinating movement, a rapid blood pressure drop when you stand up, and trouble urinating. And as you see, a lot of these features did overlap with the common features of OPCA. Like OPCA, MSA is typically developed in older adults with an average onset of 54 years old.
General characteristics. Spinocerebellar ataxia is currently the most common feature associated and overlapped with OPCA. It's a neurodegenerative disorder affecting the brainstem and spinal cord. Common features include slowly progressive decrease in gait, poor coordination of hands, and eye movement challenges. Ataxia, neurological diseases that affect movement and coordination. Common side effects includes trouble with balance, coordination, swallowing, and speech.
And as you can see, these also overlap with a lot of the features of OPCA. So treatment varies for each stage of the disease. However, SLPs typically assess and treat the following: dysarthria, and something they may do is have an informal swallow evaluation and or modified barium swallow on top of therapy. Dysprosody, which treats prosodic functions such as stress or intonation in speech that are compromised and or eliminated with OPCA. Dysphonia, which helps treat hoarse voices or reduced loudness, components of the dysarthria as mentioned. Progressive limb weakness, so the SLPs may try to support mobility of use of gestures. And increased cognitive difficulties, so the SLP may treat and assess executive functioning, memory, planning, social attention, etc.
Current medical treatment approaches. There is no cure for OPCA. After symptoms begin, individuals typically live 20 years. Medication may alleviate ataxia, tremor, rigidity, stiffness, spasms, sleep issues, depression. Physical therapy may help individuals create physical routines for exercising and stretching. Walking devices may provide support with gait, and advocacy support groups and therapy may increase individuals' quality of life and emotional well-being.
Lastly, additional info and features that may affect the client's communication functions include if there's any other additional medical condition that the client has, such as cancer, MS, or old age. And the client's motivation and emotional state may also affect the progress that he or she makes in therapy and the overall trajectory of OPCA.
Here are our references and any more literature that you would like to research on OPCA. Thank you.